All right, buckle up, everyone. We're about to dive deep into healthcare today, an area that's, well, under immense pressure right now.
It really is. You see it everywhere, the long wait times, provider burnout, which is a huge issue.
Yeah, and just the complexity of trying to give care that's truly personalized.
Yeah,
It feels like we're constantly playing catch up.
exactly. And that's why generative AI or Gen AI is such a hot topic here. It's different from older AI.
How so?
Well, it doesn't just analyze data that exists. It actually creates new things, new data, new content, even potential solutions. It learns from massive amounts of information first.
Creates new data.
Okay.
And you mentioned some key traits, emergence and homogenization.
Right. Emergence is fascinating. It's when the AI develops capabilities we didn't explicitly program as it gets bigger and more complex. Unexpected skills, sort of.
Ah,
And homogenization means it acts like a common shared intelligence base that lots of different specialized AI tools can then build upon.
got it. So it's not just another tool. It sounds like a fundamental shift. Our mission then for this deep dive is to really explore how Gen AI could, revolutionize things, both on the clinical side and the operational side.
Absolutely. The aim is really making healthcare more proactive, predictive, and definitely more precise.
So let's start with the clinical side. What does this mean for, say, personalized medicine, making treatments truly specific to an individual?
This is where Gen AI gets really powerful. It can sift through enormous data sets. We're talking genetics, lifestyle, real-time health data to tailor treatment plans just for you.
Give me an example.
Okay, like predicting your risk for heart disease just by looking at an image of your retina. Or designing new drugs. There's a model called Gene NT-REL that helps design molecules for specific biological targets in a person.
Wow.
And get this, it can even create synthetic patient data using something called GANs, generative adversarial networks.
Synthetic data. So fake patient records. Why would you do that?
It sounds weird, but it's incredibly useful, especially for rare diseases where you just don't have enough real patient data to study effectively.
Ah, I see. So you can train AI models without compromising the privacy of the few real patients you might have.
Exactly. The key is making sure this synthetic data is statistically accurate, that it mirrors the real-world complexities without actually being tied to any real person. It's a careful balance.
Okay, that makes sense.
Yeah,
And this isn't just theoretical, right? It's moving into practice, like in surgery.
definitely. Gen AI is helping surgeons by pulling together all sorts of complex patient info scans, medical history, to speed up decisions before or even during surgery.
Are there companies actually doing this now?
Yeah, there are collaborations like Johnson & Johnson working with NVIDIA. They're using AI to analyze surgical videos, find patterns, maybe even automate some of that tedious post-op documentation.
Oh, the documentation, I hear. That's a major source of burnout for doctors.
It absolutely is. And that's another huge area where Gen AI can help alleviating that provider burnout. So much time is spent on administrative tasks, not direct patient care.
So AI could potentially handle some of that paperwork.
It seems like it. There was a study using GPT-4, one of the big language models. It showed it could draft empathetic, appropriate responses to patient messages.
Really?
Empathetic. Yeah, the results suggested it could significantly reduce the mental load and, exhaustion for medical staff, freeing them up for more face-to-face interaction, more actual care.
That could make a massive difference. Okay, so that's the clinical side. What about the operational gears of healthcare, the
Yeah.
behind-the-scenes stuff?
Right. It's not just patient-facing. Take medical education, for instance. Gen AI is creating these incredibly realistic simulations
Simulations of what?
of human anatomy or rare clinical scenarios that students might not otherwise encounter during training. It allows them to practice skills in a safe, controlled way.
And I guess you could tailor the difficulty or the cases to each student.
Precisely. It enables truly personalized learning paths, adapting to how well a student is doing.
Okay, training. That makes sense. What about the financial side? Billing, coding.
Yeah.
That always seems complex in healthcare.
Oh, definitely. Revenue cycle management, or RCM, is a huge operational area. Gen AI is starting to automate tasks like medical coding from doctor's notes, handling billing, checking for compliance,
Which must save time and reduce errors.
significantly. One study suggested RCM professionals could save like 40 to 50% of their time on certain tasks. Companies like Codemetrics and Adonis.io are already using AI for this, pulling structured data from unstructured notes for billing, providing revenue insights.
So pulling it all together then, we're seeing Gen AI touch almost everything from super personalized treatments and easing doctor burnout all the way to training the next generation and smoothing out the finances.
It's incredibly broad, and the key theme seems to be augmentation, not replacement. It's about empowering the human experts, making them better, faster, maybe even freeing them up to be more human.
That's a really important point. It's enhancing human capability.
Exactly. Which leads us to the final thought, really, for you listening. As this powerful technology weaves itself deeper into healthcare, what are the absolutely critical things we need to get right?
You mean like the ethical guardrails?
Precisely. Things like, how do we ensure patient data stays private and secure? How do we identify and fight algorithmic bias so that tech helps everyone fairly? And how do we maintain transparency so we understand how these AI systems are making recommendations? These are the questions we have to wrestle with to make sure this innovation truly serves humanity.